The Kentucky Healthy Futures Initiative, or KHFI, is a partnership of the Foundation for a Healthy Kentucky, the Federal Social Innovation Fund, and 9 local health and healthcare partners around the Commonwealth. This unique public-private collaboration model sees each federal dollar matched by $3 from the Foundation and its partners.
The Social Innovation Fund nationally and the Kentucky Healthy Futures Initiative in Kentucky wouldn't work unless a lot of people had come together. Their hearts, their good ideas, their pocketbooks. Because this wasn't a case where the federal government funded from the first dollar to the last, or that we did that. This is a case where everybody had to put some money in the project and bring their good ideas to the table and work together.
The Meade Activity Center started off as a group of civic-minded individuals in the Meade County community who saw a lack thereof for opportunities for health and wellness. In about 2008, they started kind of coming together and turned a general idea into a reality in 2011. And basically from that time, we've been able to do a lot of good things, primarily due to our collaboration and granteeship that we've received from the Foundation for a Healthy Kentucky. And we offer the Catch After School program, which is primarily a way for us to offer elementary age students between grades 4 and 6 the opportunity to come into the schools twice a week, work on different aspects of physical activity, nutrition, and just giving them time to be with other folks in a social setting a couple times a week.
I grew up close to here. I grew up in Bath County and Salt Lake, Kentucky. Growing up here, I know that there weren't a lot of providers. A lot of times you couldn't get in because it was overbooked, understaffed. We started noticing, that we needed cardiac, we needed pulmonary, we needed different specialty care in the area, something that wasn't here.
Well, I've lived in Mount Sterling all my life. I live by myself and stuff, and the finances aren't as, as good as they should be. And when this came about over here, and I've been coming over here for about 4 or 5 months, I think it is, and I just love it over here. I've went different places and stuff, and there's no one there to help you. But this place has really helped me.
A lot of our telehealth equipment has been provided through the grants that have been provided through Kentucky Healthy Initiatives and also through the Social Innovation Fund. Grant money is funding this clinic's expansion. We started with nothing as far as this telehealth equipment goes, but because we have this funding now, we have, telehealth equipment. We can bring in providers that we weren't having in these areas before. And the plan for us is, we start out, this grant money is kind of the seed money that we need to get things started. Then once we get that up and running, we hope to have the ability to support our own. So this grant money is not just affecting this clinic, it's affecting this community and other communities.
Really, we're looking and reaching out to men and women aged 18 to 64 years old that have risk factors for cardiovascular disease. Unfortunately, the prevalence of these risk factors is very high in our community, probably more than half. We understand that there are a variety of things that contribute to the risk factors for heart disease. It might be obesity, smoking, high blood pressure, education and poverty are really very inextricably linked to health. What we're trying to do is to work with men and women, not just to screen them, but also talk to them, educate them, help identify any barriers that might exist to them reaching their optimal wellness goals, and help work with them to get them to a primary care physician. Through the KHFI project, we've been able to partner and learn from neighborhood organizations, from our partners, lessons learned. We've been able to have access to resources about evaluation and program planning, and so it's been such a tremendous opportunity for us to work with them.
Well, for 31 years, I was a surgical assistant and had insurance, good pay, benefits. Well, I lost my job last year. And because I needed refills on my medication, my doctor wouldn't see me because she hadn't seen me in a year. So I couldn't afford her regular prices. Here, it's not very much money. It's based on the lowest cost for an office visit and for labs and stuff. And I don't know what I would have done if we didn't have this.
We like to be #1 in basketball. We don't like being #1 in obesity, smoking, lung cancer, diabetes. Every time there's a new CDC report, you know, we kind of cringe when we come near the top 5. We don't want to be in the top 5 in that poll. So in looking at that, and our lack of activity, all those things that contribute to disease, the foundation has provided partial funding for this grant, so we can be proactive in addressing these needs. Together with, what I like about this clinic is that we have multiple sources of funding. We have the foundation, we have Baptist Northeast, we have community churches, private donors, and I think it's an excellent model for our nation because it's not just one quick fix. It's a lot of people coming together.
We like to think we're showing America what Kentucky can do when we have the resources and put our minds to it.
The Social Innovation Fund represents an exciting new approach to improving communities by mobilizing both public and private resources that support local nonprofits. Rigorous evaluation tools are utilized to track evidence of program results. So far, KHFI initiatives offering health services and opportunities for physical activity have served thousands of people across the Bluegrass.